Hi, my name is Bridget Dorsey, and I am going to talk about this project that I've been working on with Dr. Albert Park at Primary Children's Hospital. So the premise of the project is that congenital CMV, which is a prevalent cause of sensory neural hearing loss in children, is often hard to diagnose. So we want to know if there are patterns in the audiograms of these children that could distinguish congenital CMV-related hearing loss. And at this stage in the project, we see that congenital CMV-infected children present with a larger difference in hearing loss between the better and worse hearing ears when compared with children with LVA, which is another cause of sensory neural hearing loss. Okay, so for a bit of background information, congenital CMV is the most prevalent congenital viral infection in the world, and it accounts for at least 1/3 of sensory neural hearing loss cases in young children. And about 5 to 15% of those children only experience sensory neural hearing loss, so they're otherwise asymptomatic, which also makes it hard to diagnose. The formal diagnosis requires a PCR test, and the sample has to be collected within 30 days of birth to distinguish postnatal infections from congenital infections. And the challenges with this diagnosis include low sensitivity and specificity for the dry blood spot PCR. There can also be breast milk contamination in saliva samples, giving false positives. And there's also just a lack of testing for infants who are asymptomatic at birth and also past their newborn hearing screening, which is the case often because a lot of children don't present with hearing loss until later in childhood. So identifying these audiometric characteristics that we are looking for in this study could really help physicians and audiologists to make informed predictions about not only the hearing and health trajectory of these children, but also potential treatment options. So what we are doing is looking at the first complete unaided behavioral audiograms of children with confirmed congenital CMV and LVA. So we have 13 congenital CMV patients enrolled and 20 LVA patients, and from those audiograms I have calculated pure tone averages and also determined the degree of hearing loss for each ear, and then the symmetry or asymmetry of that hearing loss. And in figure 1, you are looking at the degrees of hearing loss for the better ear, which is figure 1A, and the worse ear, figure 1B, for both congenital CMV and LVA patients. And so there you can see that these results are not statistically significant, but they still sort of suggest that congenital CMV patients might present with more normal hearing in the better ear and profound hearing loss in the worse ear, while the LVA patients often present with more mild and moderate hearing loss in both the better and worse ear. Figure 2 shows the pure tone averages for the better and worse hearing ears of both diagnostic groups, and while not statistically significant, you can kind of see how the variation differs between the two groups. And in figure 3, you can see that the average difference in the PTA between the better and worse hearing ears is statistically significant. So figure 4 is showing the difference in symmetry between the two groups, which is also significant. And sort of altogether, these results show that while almost 1/3 of the congenital CMV patients present with symmetric hearing loss, and only about 5% of the LVA patients do, the congenital CMV group shows a significantly greater difference in PTA between the better and worse hearing ears. So this sort of indicates a broader claim, which is that the congenital CMV patients, when they're presenting with asymmetric hearing loss, have very different PTAs in the better and worse ear. So to just sort of tie everything together, I just want to come back to the point that congenital CMV-related sensorineural hearing loss is difficult to diagnose, but the diagnosis is really important because initiating treatment and interventions are valuable parts of improving quality of life for these children, especially because they're presenting with profound hearing loss often. And these preliminary results are indicating that the congenital CMV patients are presenting with both symmetric and asymmetric hearing loss, but often the profound sensorineural hearing loss in the worse ear and normal hearing in the better ear sort of distinguishes these cases. And future work for this study includes comparing these audiograms to the audiograms of children with connexin 26 disorders, and that will help us sort of further identify the differences in the hearing loss pattern for these different diagnostic groups. Another thing that we'd like to look at is the hearing loss progression using multiple audiograms from different time points, and that's something that I hope we get a chance to look at. And I'm really excited about the future of this project and really grateful to be working on this with Dr. Park and to have learned so much from him and Ashley Earp as well. So thank you.